Hello, and welcome as we discuss the 5 A's and 2 A's plus R methods for discussing cessation resources. Since 1919, Lorain County Public Health has made health a priority in Lorain County. We protect your well-being, prevent disease, and promote overall health for everyone who calls Lorain County home. Today, we will discuss why tobacco is still an important health topic, learn ways to discuss cessation with a tobacco user, and what cessation resources exist locally. Tobacco may feel like an outdated topic, and while it certainly doesn't get the most attention, it is still a major health concern. Smoking remains the leading cause of preventable death and is responsible for 1 in every 5 deaths in the U.S. Tobacco deaths outnumber opioid deaths. While many health issues are worthy of work and attention, we must not forget what is still killing the greatest number of people. In the most recent Lorain County Community Health Assessment, which is a county-wide survey of the health of county residents, 12% of Lorain County adults stated they were current cigarette smokers. This rate is lower than it has been in previous years, which is great news. Almost 1/4 of adults indicated that they were former smokers who have quit, which serves as a great reminder that many people do successfully quit smoking. People in Lorain County who are still currently smoking are more likely to have rated their overall health as poor, have incomes below $25,000, be female, and be between the ages of 30 and 64. These are the populations we'd like to reach with cessation resources. Smoking causes many health issues that people think of as unrelated to tobacco. Everybody knows smoking causes cancer, but did you know that smokers have an increased risk for type 2 diabetes? Or that 1 in every 4 cardiovascular disease deaths, including heart attacks and strokes, is caused by smoking? These are important considerations for anyone who cares about the health of people in Lorain County, as smoking impacts so many areas of health. Smoking impacts smaller areas of health as well, including generally reducing quality of life. Deaths from smoking don't always appear as lung cancer, which may be what people think of first. Here are other health issues cigarettes cause that decrease quality of life and shorten lifespans. Nearly 500,000 deaths each year in the U.S. are because of cigarette smoking. Now that we've discussed the current burden of tobacco use, let's talk about how to encourage people to keep trying to quit. Most people know that smoking is bad for them and don't want to feel attacked, lectured, or made to feel dumb. While we did just discuss the many harmful effects of tobacco use, when speaking with a current tobacco user, focus on the benefits and all they have to gain. Here are some important things to keep in mind. Most people do not quit on their first attempt and find that a combination of resources works best in the end. Encourage them to keep trying, even after many attempts. The benefits are worth it. We're going to discuss 2 methods of discussion cessation with a current tobacco user. The first method is called the 5 A's, shown here. Let's discuss each step. The first step, or A, is to ask, do you use tobacco? Or what tobacco products do you use? We want to be careful to ask this, in a non-judgmental, straightforward way that doesn't shame tobacco users or set them up to be dishonest. Fit this question in wherever it fits best in your interaction with clients. The second A, or step, is to advise them to quit smoking. Be strong in this statement. Acknowledge that many people need multiple attempts, so just because they haven't been successful in the past doesn't mean they shouldn't try again. Encourage the use of resources. Here is a list of some of the many health benefits of quitting, some that start within minutes of quitting. Use these as encouragement when advising. Blood pressure and blood oxygen levels begin to improve the same day a tobacco user begins to quit smoking. In just a year, heart disease risk is cut by 50%. We are often asked about the financial costs of smoking to the user in tobacco products. It's more than $100,000 over a lifetime. Of course, this doesn't take into account all the other health costs caused by smoking. What else might that person rather spend their money on? Step, or A3, is to assess. Is this person ready to make a quit attempt? If the person states that they are absolutely not ready to make a quit attempt right now, that's okay. Do not berate the person. Again, most people know that smoking is bad for them and can be honest with themselves if they personally are ready to make a good quit attempt. It's best for you to maintain a positive relationship with that person so that when they are ready to quit, they are willing to discuss it with you. Step, or A4, is to assist the person with accessing cessation resources. Let's talk about the many options available. All of the resources we are going to discuss are listed on our website, loraincountyhealth.com. Search Quit Smoking. The Ohio Quit Line is a real resource that everyone in Lorain County and throughout Ohio can use. The Quit Line has tobacco cessation coaches who call and provide personalized quitting support to each person who enrolls in the Quit Line. It's available in English and Spanish to everyone, regardless of insurance or income. The Quit Line also mails nicotine replacement to eligible participants, including patches, gum, or lozenges. There are special benefits and considerations for pregnant participants and new moms. Here is the Quit Line website, where you can also refer people, especially if they aren't ready to call and enroll with a coach. Here in Lorain County, we also have a number of local, in-person certified tobacco treatment specialists. Certified tobacco treatment specialists are trained professionals to help community members develop a plan to quit tobacco for good. People can call and meet with someone locally who they may feel more comfortable with, many times at no cost. Don't forget, a person's primary care doctor is a great resource and can also prescribe medications. There are also special resources for teens and young adults. 2 programs that are free and confidential to teens are the My Life, My Quit program through the Ohio Department of Health and the This Is Quitting program through the Truth Initiative. Both are texting programs for teens to help them develop a quit plan designed mostly for e-cigarette users. These plans do not report use back to parents, teachers, or healthcare providers, so teens can use them privately. Parents of teens can enroll in their own program from the Truth Initiative to help them through their teens' quitting journey. The last A step is to arrange for a time to follow up. Check in and see how the quit attempt is going. A shorter version of the 5 A's is the 2 A's plus R, which may be better suited for your interactions with clients. This version begins the same way with the ask. Just as before, you want to be direct and non-judgmental. The second A, advise, is also the same with a personalized approach that highlights the benefits of quitting. This shorter version ends with a referral to Cessation Resources. Refer to any of the resources we discussed today, including the Quit Line, local certified tobacco treatment specialists, and healthcare providers. Thank you for taking the time to learn about tobacco cessation resources today. Please feel free to contact us with any questions.